All right. Good day, everyone. We are going to give it just a few more seconds here while people are joining the webinar. So please hang tight. You are in the right place, and we are just so glad that you're here today. So yes, give us a few more seconds and we'll get started. All right. Well, hello, and thank you for joining us today. My name is Jamie, and I am the Dedicated Wellbeing Services Program Manager with WebMD, here to present Perimenopause and Menopause. And I am joined by my colleague Maria, who is a health promotion consultant with the Washington Wellness team. Our agenda for today is to first define hormones, then review hormones that affect women's health, learn about hormonal imbalances, examine menopause and perimenopause, discuss lifestyle tips to ease symptoms, talk through resources and support, and then we will close with a loving kindness meditation practice. And as we discuss women's hormonal health in this presentation, we do want to clarify that the information provided primarily pertains to individuals assigned female at birth. Hormonal health is a complex and deeply personal topic, and for transgender individuals, particularly those undergoing hormone therapy, it is essential to consult with your healthcare provider. Your doctor can provide personalized guidance on maintaining hormonal balance and understanding how it evolves over the course of your life. This presentation is not a substitute for medical advice and is intended to provide general information to empower informed decisions with your healthcare professional. All right, so let's start today with a brief review of what hormones are. So hormones are made in the endocrine system of the body, and they act as chemical messengers to tell your body to regulate a wide variety of functions. They are important for many important processes such as your mood, growth, metabolism, and reproduction. There are more than 50 hormones in the human body, and we definitely don't have time to cover them all, but I did just want to call out on the left side here, we have a few hormones that are involved in women's reproductive health, including hormones like estrogen or follicle stimulating hormone. And then on the right side, you can see some of the other hormones that are involved in overall health that you may also be familiar with. Now, in terms of hormone imbalances, hormones have a huge impact on the body, so even small changes can have major effects. Additionally, an imbalance of one hormone can have a cascade effect on other hormones. And hormonal imbalances can be caused by certain conditions and can also cause chronic conditions such as PCOS or polycystic ovarian syndrome and diabetes. Hormone imbalances can and do occur regularly in women's reproductive systems, and often they have a specific purpose. So we see these in pregnancy and breastfeeding to ensure the proper development of the fetus. Birth control is designed to create a hormonal imbalance to prevent pregnancy. And during menopause, it is the imbalances in hormones that give rise to specific symptoms.
Thank you, Jamie. Now let's move on to talk about a major source of hormone imbalance, menopause. There are a few different stages or types of menopause to be aware of, starting with perimenopause. This is the time period leading up to menopause where the body is beginning to undergo hormonal swings that we'll cover more in upcoming slides. Perimenopause can last anywhere from 2 to 8 years, and the average woman experiences perimenopause in their 40s and 50s. The medical definition of menopause refers to a moment in time when a woman has not had any menstrual periods for 12 consecutive months. And then premature or early menopause is when this occurs before age 40. So perimenopause is the transitional period between female reproductive years and menopause, or the end of reproductive years. Perimenopause is characterized by significant fluctuations in estrogen and progesterone levels, which lead to the symptoms seen on this screen, which include irregular bleeding, hot flashes, challenges with sex, urinary issues, mood changes, memory challenges, sleep issues, to name a few. These symptoms can cause quite a bit of discomfort, but you don't have to suffer through it. Talk with your doctor about how to manage these symptoms. You might also look for a support group, either in person or online, where women share different things that have worked to help them manage symptoms. You can also check with your local hospital, clinic, or university to see what's available in your area. After 12 months with no menstrual periods, we are officially in menopause, and the levels of reproductive hormones change dramatically. The two main female hormones that are involved with menopause are estrogen and progesterone. These hormones play an important role in reproduction. During perimenopause, levels of estrogen start to fluctuate seemingly at random. At the same time, progesterone levels start to drop. At menopause, estrogen is produced at a very low level, and progesterone production ceases completely. It's these changes in hormone levels that lead to most of the menopause symptoms we hear about or may be experiencing. Testosterone is another hormone that changes over time. It plays a key role in estrogen production in women. Testosterone peaks when a woman is in her 20s and then declines over time. So by the time a woman reaches menopause, testosterone levels are roughly half of what they were at their peak. Testosterone is still produced by the adrenal glands and ovaries, just at much lower levels. It's important to know that certain health risks can increase during menopause. Lower levels of estrogen can raise the risk of stroke, heart disease, and osteoporosis. These are compounded by the natural aging process. We're also exposed to lead throughout our lives, which is stored in our bones. When our bones start to break down, this can actually release the lead into our bloodstream, increasing the risk of high blood pressure and atherosclerosis, or hardening of the arteries. It can also have a negative effect on kidney function and cause symptoms similar to dementia. Teeth and gums are prone to hormonal changes in perimenopause, causing a decrease in our ability to fight off infections in the oral environment, like increased bacteria and dental disease causing receding gum lines. Lower estrogen levels can also lead to more fat storage in the abdominal area. Again, you'll want to talk with your doctor to see whether you need to pay any additional attention to these risks. Now let's discuss lifestyle tips you can keep in mind to help maintain hormone balances and soften symptoms. Starting with exercise. This can help your mood, weight management, and hot flashes. The recommendation is to get 150 minutes of moderate intensity exercise per week. And of course, this can be broken up into segments as short as 10 minutes at a time. Avoiding smoking, nicotine products, and alcohol. Smoking can intensify symptoms like hot flashes and sleep disturbances. And alcohol has been linked to worsening symptoms as well as increasing your risk of osteoporosis and heart disease. Limiting caffeine, which has been linked to an increase in hot flashes as well. Maintaining a healthy weight. Studies have shown that women who are overweight suffer from more severe symptoms, including sleep disturbances, mood swings, and hot flashes. Avoiding spicy foods, which have been linked to an increase in hot flashes as well. And then reducing your stress and building stress management skills. Stress can make virtually any symptoms more severe, so making sure you have the tools to manage your stress is really important. And then a few additional recommendations. Lean into your social support and connection. It's important to continue to connect with your friends and family to build or maintain a healthy, supportive social network. Protecting your sleep as well. Go to sleep and get up around the same time each day. Try to skip taking naps, especially later in the day. And create a peaceful bedtime routine like reading, taking a relaxing shower or bath, listening to music, and avoiding screens and electronics. And get comfortable. If hot flashes are bothering you, adjust your thermostat. Make sure you have cool water on you. Layer your blankets with various thicknesses so you can take them off or put them on easily. Also dress in layers so that you can add or remove clothing as needed. Try meditation or relaxation techniques. There are many things that we can do to help kind of maintain that relaxation and stress reduction. Options that hopefully you're already aware of, but want you to take advantage of if you're not currently doing so. These include Smart Health, which is our online well-being platform that has a wide variety of recommendations and information and activities you can participate in to try on healthy behaviors. We also have Living Tobacco Free. These are tobacco cessation support options offered through our medical insurance plans. And then, of course, there are community resources for tobacco cessation as well. Diabetes management programs help people currently living with diabetes to more effectively manage their blood sugar and their insulin. And then diabetes prevention programs help to identify people who are at risk of developing diabetes and implementing lifestyle changes before the onset of diabetes. So in diabetes prevention programs, you'll be paired with a health coach, sent a SMART scale to help monitor your progress, and then there's also a peer support aspect as well. There are a variety of health and fitness discounts available that can be found on the Washington Wellness website as well. And then whether you use the state of Washington's EAP or any other private vendor, employee assistance programs are very helpful with stress management, and then they may also have different health and fitness discounts offered through their portal as well. So in summary, hormones play a critical role in the human body. Female reproductive hormones naturally fluctuate from month to month and also over the lifetime. Hormonal imbalances during menopause and perimenopause can be disruptive and lead to health issues. And most importantly, managing these imbalances through medical care and healthy lifestyle choices can improve your overall health and well-being.
All right. And as we close out our webinar today, we wanted to end with a loving kindness meditation practice, as it is an effective way to tend to our inner systems. The loving kindness meditation is used to strengthen feelings of compassion, kindness, and acceptance towards oneself and others. It typically involves opening the mind to receive love from others and then sending well wishes to loved ones, friends, acquaintances, and just all living beings. Because this type of meditation is intended to promote compassion and kindness, it may be ideal for those holding feelings of anger or resentment or frustration. Negative emotions can also reduce your tolerance for pain. Positive emotions, like those cultivated through meditation, have the opposite effect. After you recite kind phrases toward yourself, you extend that kindness to other people. This allows you to display compassion and empathy toward them. It also encourages you to think about others and to recognize how they make you feel. Plus, as you develop self-love, you may be less likely to view yourself or your situation negatively. This makes it easier to hold space for others, which can cultivate more positive connections. Now, we will just do a quick version of this practice. You don't need any special equipment or gear to get started with the meditation. Another bonus is that you can do it from anywhere you like, whether that's a quiet corner of your home, outdoors in a yard, or even at your desk. Try to choose a spot where you're least likely to be distracted. Then follow these steps. Sit in a comfortable position. Close your eyes. Take a slow, deep breath in through your nose and continue breathing deeply. Focus on your breathing. Imagine your breath traveling through your body. Focus in on your heart. Choose a kind, positive phrase. Silently recite the phrase, directing it toward yourself. You can say, "May I be happy. May I be safe. May I find peace." Or, "May I be strong. May I be resilient. May I be understanding." Slowly repeat the phrase. Acknowledge its meaning and how it makes you feel. If you get distracted, avoid judging yourself. Just return to the phrase and keep repeating it. Now, think about your friends and family. You can think about a specific person or a group of people. Recite the phrase toward them. May you be happy. May you be safe. May you find peace. Again, recognize the meaning and how you feel in this moment. Continue reciting the phrase toward others, including neighbors, acquaintances, colleagues, and difficult individuals. Recognize your emotions, even if they're negative. Repeat the phrase until you experience compassionate feelings. Some people use visual imagery while reciting each phrase. So for example, you can imagine light emitting from your heart or the person you're thinking of. Hold that imagery for a few more deep breaths, and we will begin to slowly open our eyes and go about our days. Or if you have a few more minutes to breathe, please take whatever time you need. Take good care and be well.